Everyone should give their mental health a high priority. You've come to the correct place if you're seeking for advice on how to change your thinking, information on mental health disorders, how to obtain assistance, or more resources. The subject of mental health is wide and has many facets. It influences how we feel, think, and act, and involves our psychological, social, and emotional health. You are not alone if you battle with mental health problems. While going it alone might seem daring, asking for support requires strength. We appreciate your visit. Depression. More than 16 million people in the US experienced depression last year in a variety of forms. We all experience depression or other negative emotions. An odd, terrible day, but a recurring sense of melancholy, foreboding, or hopelessness is unhealthy and could be an indication of depression. One of the most prevalent mental health conditions in the US is anxiety disorders. Before an exam, on the first day of work, or in a novel social setting, anxiety is common. But if your anxiety is persistent and affecting your daily activities and choices, it might be time to consult a mental health expert. Improve your mental fitness. We all occasionally experience tension and worry because life is not without difficulties. Self-care techniques and learning good stress management techniques may enhance mental health and general well-being. Knowledge of mental health. Depression. Sadness is a normal, healthy emotion. Some people experience sudden sadness that is brought on by something as simple as a song playing on the radio. It wanes and wanes. Others, however, struggle to identify the cause of their unhappiness, and their sad feelings persist. They cannot snap out of it or exert control over it. It results in persistent emotions and thoughts. Many people struggle to focus, lose interest in routine daily chores, and feel exhausted. These are all symptoms of depression, a mood condition sometimes known as major depressive disorder or clinical depression. You are not alone if you or someone you know struggles with depression. More than 16 million individuals in the last year. There was depression in the United States. Despite being a serious ailment, depression is treatable, and assistance is nearby. Anyone, whether they are 13 or 30, can have clinical depression. However, not everyone experiences the same symptoms, depending on their age. It's a very genuine diagnosis, and it differs between adults and children, according to Dr. Marcy Billings, a pediatrician at the Mayo Clinic. However, in a toddler or adolescent, you might witness more irritability, increased crankiness, or isolative conduct. The traditional melancholy mood may be a typical adult sign. Of course, these kinds of mood fluctuations can also be indicative of regular adolescent behavior, which can make it more challenging to identify teen melancholy. However, according to Dr. Billings, alterations in their usual behavior can be especially revealing. The desire to get out with pals that they formerly had has vanished. Grading is being affected. To complete the tasks they typically complete each day is difficult for them. Constantly worn out, they can struggle with sleep. They may struggle with eating. Weight gain or loss is another sign of depression that seems to be different in adults than teenagers. With youngsters, however, you might see that they're not gaining weight adequately, or they may be gaining excess weight. According to Dr. Billings, this is less likely to occur than it is with depressed adults who frequently lose significant amounts of weight very quickly. The good news is that there are many effective treatment choices for both adults and children, despite the fact that depression may be a difficult and emotional problem. In the event that you or a loved one needs assistance with depression, you should start by speaking with your primary care doctor. Dr. Billings asserts that we can treat adolescent depression really well. Sadness, apprehension, emptiness, or hopelessness, outbursts of anger, irritation, or frustration, even over trivial issues. Loss of enjoyment or interest in most or all regular activities, such as hobbies, sports, or sex. Excessive sleeping or insomnia, lack of energy and fatigue make even little chores more difficult. Appetite changes, such as decreased appetite and weight reduction or increased food desires and weight gain. A feeling of unease, anxiety, or worry, sluggish speech, posture, or other body movements, feelings of guilt or worthlessness, obsessing about past mistakes, or blaming oneself for situations that are not your fault, difficulty with memory, concentration, decision-making, and reasoning. Promote therapy. People who are sad cannot be aware of or admit their depression. They could believe their sentiments are normal since they are unaware of the warning signs and symptoms of depression. People incorrectly assume they should be able to cure their depression with effort alone because they feel humiliated about it all too often. But without treatment, depression rarely gets better and sometimes gets worse. The person you care about may improve with the appropriate course of treatment. Inform the person of your observations and your concerns. Describe how depression is a medical problem, not a character flaw or weakness, and how treatment can typically make it better. Suggest getting expert assistance. I hope seeing this video would help you all feel better. Thanks for watching. Keep smiling, keep hustling.